Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, a range of supplements formulated to support those diagnosed with chronic kidney disease live a better, fuller, healthier life. I am so excited today to be running this podcast with a new guest to our show. Therese is an amazing Australian. She's a consultant pharmacist. I met her by being a participant on her podcast a few weeks ago. And after we finished recording, we started to have a conversation, and I was really intrigued by the way that she works, supports patients, and she has an absolute interest in kidney disease because she's seeing it all the time with just how she works with patients. So Therese is a consultant pharmacist, as I mentioned. She's a health strategist. And she's a wellness researcher. She specializes in bridging the gap between traditional medicine and functional health strategies. She's got an absolute keen focus on chronic conditions like kidney disease, metabolic syndrome, high blood pressure, all the things that we know contribute to a decline in kidney function. And she provides practical, science-backed solutions that empower you as an individual to take control of your health. Unlike conventional approaches that often focus solely on symptomatic management, Therese takes a deep dive into analysing blood tests, identifying nutritional deficiencies, assessing how medications, particularly diuretics, impact kidney function. So her goal is to equip people with substantial strategies that optimize health and prevent further decline. She's also the host of the Enlightened Pharmacist podcast, something I've had the pleasure of being on, and she's on a mission to help tens of thousands of individuals reclaim their health through personalized care, diet, lifestyle modifications, and medication insights. Therese, welcome to the podcast. I'm so excited to have you join us today.
Thanks, Fiona. It's so good to be here.
And you are the first pharmacist we've had. So I'm really keen to hear your take on things like kidney disease. You know, as naturopaths and functional medicine practitioners, we do know that there are a lot of medications that will contribute to kidney decline. We were just talking before we hit record about how often I have patients that are, as they get older and they're elderly, they're on polypharmacy. So they're often on, I was just telling you about a patient that was on 27 different medications, and I generally always see a decline in kidney function there. And I'm often wondering how much is natural kidney decline versus medication kidney decline. You were just talking to me about how you do a lot of reviews for GPs and just checking polypharmacy, making sure that everything isn't offsetting one another and consolidating stuff. But I know we're talking beyond medications today. We're talking about a holistic approach to kidney health with how you see it as a pharmacist. So I think let's start there. Like, what are the common things that you see when you have a patient come in, particularly with kidney disease, and how, as a pharmacist, you would look at that, and maybe some tips and things that you see that I wouldn't be looking at, and maybe some of our viewers hadn't even thought about.
It's really fascinating with kidneys, because I've seen thousands of patients, and what I've noticed is that they might have the same medical history. One has diabetes, one has got heart failure, and they might have, and as time goes by, because in my medications reviews, I get to see them every 2 years. It's all funded by Medicare. The thing that weighs them down is their declining renal function. I mean, it's a marker of so many markers of quality of life, their bladder health, like how often they go and pee at nighttime, heart disease, diabetes, cancer, infections, stroke. The list goes on and on. With the kidneys, we know that it doesn't actually regenerate while the liver does. It's such a precious organ. And the issue is in Australia, 6 million Australians have chronic kidney disease. And that's about 1 in 10 Australians, 1 in 5 First Nations aged over 18 years are living with signs of chronic kidney disease. And that means like it's a silent killer. It's a disease of slow burn, so really hard to pick up at face values when you look at the labs. But we know, like, as someone grows older, their kidney function declines, and they might not know about it because 90% of kidney function, as you're well aware of, is lost before people experience symptoms. So I remarked to a colleague of mine, like, there was one particular patient that stood out, and he had beautiful renal function, and I was like, oh my goodness, this is so amazing. But then my colleague looked at me and he said, oh yes, he might have good renal function, but then I have Parkinson's and I have good renal function. And that made me think of, Fiona, like how, okay, in mainstream medicine, we there's a disconnect between all the different organs. We might think like the kidneys, you see a renal physician to actually have a look and diagnose and treat the person. But because it's a whole body problem and it's systemic and inflammatory, I mean, we need it for detoxification, water balance, electrolyte balance, red blood cell, hormones. And the key thing is when I see patients, I have a list. We go through like their sleep pattern, how many times they wake up to pee, how is it disrupting their sleep cycles, and things like medications like new ones that really misses the radar, like SGLT2 inhibitors for diabetes, where they help you pee sugar, things like that. It really actually affects your kidney function, your quality of life, and how often they get infections, their pH balance, how often they get admitted to hospital, their energy, like how fatigued they are. So it's widespread in terms of, if you actually listen to the patients closely and you look at their signs and symptoms, and this checklist I have, you figure out from the way and how they sleep is a good indicator of their kidney health.
Yeah, so fascinating. And so obviously you're seeing more an aging population, or are you seeing all sorts?
And my youngest patient is 26 and my oldest is 102.
So oh, wow. Amazing. 102. What's her kidney function like?
Unfortunately, it was declining. She was lovely because, she loved the Queen, and when she watched the funeral of the Queen, she lost like a massive amount of weight. It's such a different generation from us and how they think, etc. So kidney function was actually a marker of, how she breaks down her medications, her food, etc. So yeah, unfortunately, as she grew older, she deteriorated. And I think somebody like you who do lots of work in terms of the kidney coach and getting like our patients back on board. So a lot of times in mainstream medicine, there's a point of no return where they think that if their eGFR is like really low, there's nothing much you can do about it. But in your work, you've actually reversed like your grandmother's like renal function. So even though it's secondary like management of chronic kidney disease, and that's really amazing.
Yeah, I mean, we've had something I didn't think we'd see, but we've had patients that have been on dialysis for, I think mum was on there for 19, 20 months, 22 months, I think she was on. She's came off dialysis. So we definitely see what we thought was kidney function where it's, irreversible is not the case, which is really, really exciting. What I'm interested in is, as a pharmacist, what medications do you see time again contribute to the decline in kidney health, or could be a contributing factor? Because I think people out there, lithium is obviously one we see all the time, long-term lithium use for bipolar, just destroying the kidneys. But are there other more silent ones or medications that you see routinely and you think, this may be contributing to a accelerated decline in kidney disease?
100%. The list is like expanding, and we know the common ones, like your anti-inflammatories, your pain medicines. They really make a dent on like your kidneys. They really cause a lot of damage there, especially long term. We know as well, like your blood pressure pills, so ACE inhibitors. And one that might just miss the radar is your proton pump inhibitors. So many Australians, they have reflux, gastric esophageal reflux disease, and they might be on a proton pump inhibitor to reduce the acid. But in fact, you can get acute interstitial nephritis from there. So again, it's about increasing the index of suspicion, looking at how they're actually sleeping, how many times they wake up to pee, whether they have fluid retention. So diuretics as well, it's sort of like a double-edged sword. You use it to actually help reduce the fluid, but in fact, it can actually cause problems with electrolyte balance, and anything that does, that impaired balance can affect the kidneys as well. And then the new diabetes medications, the one I mentioned was the SGLT2 inhibitor. So the brand name would be something like Jardiance, where it helps the patient pee sugar. However, it can actually cause problems with the kidneys as well. And as the renal function declines, we need to match up the doses of the medications. And a lot of times we use eGFR, which is a automatic calculation that the labs put together. But a lot of times the medication, their dose recommendations is based on creatinine clearance, and that requires a bit more thought in that. So a pharmacist might have a look at their height, their weight, and their ages and their creatine levels, and do a calculation to get an estimate. They're not 100%, but it gives you an indication as to we need to actually drop the dose because the dose makes the poison. So it really is about looking at the person holistically and making sure, like for the signs and symptoms that might alert us that something's not 100%, and making sure the medications are at the right doses, and making sure the ones that's causing lots of damage, it's going to be minimized. You're trying to, again, reduce it. And more importantly, if we actually look at the root cause of the problem. So, for example, with proton pump inhibitors, a lot of times I'm finding that, it's spicy foods or, acidic foods that might trigger it, coffee, spicy foods, or even the position of their bed. So when I ask them, like, what normally triggers like your reflux, and then they tell me, and if it's easily fixed, you could just use your proton pump inhibitors when necessary. It takes about 15-30 minutes for it to kick in, or even better, you can reduce those foods that might be causing indigestion, or you might raise your bed height by 20 centimeters so that the whole positioning is just right as well. And stress is massive, isn't it? Because I know that gut feel, etc. So a lot of times I might ask, like, what triggers it? And stress, it also comes up as the one of the answers. It's about having routine to help regulate stress that's sustainable to the patient, whether it's deep breathing, whether it's chewing their food mindfully, and making sure everything is sort of like at rest, and be activating the rest and digest system instead of our flight and flight, our sympathetic nervous system. So that is a really good example of one where in my reports, I always have a look at their reflux, their stress, and give the doctors a bit of a background as to why they might be having those symptoms. And perhaps with the proton pump inhibitors, they might not be as benign in terms of how the consequence, because you do need acid to break down foods and to actually absorb nutrients, whether it's iron, calcium, magnesium, etc. And also you really need to, again, ensure, like, with all these medications, that there is a risk-benefit analysis, that we're not on something forever. I've had patients that's been on proton pump inhibitors for 30 years that might not actually require it. So I think, really be checking with the patients on a regular basis. Do they really need this medication is also a tip that I would recommend.
It's amazing because I have never heard a pharmacist speak like this. This isn't something typically that, and that might be my, naivety around that sort of stuff. But I'm really impressed because I guess the bulk of what I see in pharmacy is you go into a chemist, nobody asks many questions, they hand things over. Generally, GPs are, you would assume, meant to be the ones asking the questions that you are obviously sitting down. So I'm impressed that you sit down and go back to the GP and say, did you actually ask them about the spicy food intake that they were having? And you've got people that are on medications for, people just stay on them every time they go into their doctor. The doctor writes another script and then nothing's been reviewed. And I just wonder if we had someone like you and a team of people like you reviewing every patient that was on, say, 2 or more medications every 2 years, how preventative that would be, how much money it would probably save the government. And I mean, we know the 3rd leading cause of death in the US, and I think it's Australia as well, is medications and those kind of things. So if we had this sort of process that everyone was going through that was on at least 2 medications or more, maybe even how many deaths and other chronic diseases we could prevent. It's such a wonderful service. And again, I'm sort of blown away that, definitely I've never had any of my patients coming through this. I was saying before he recorded, it's often me sending patients to gerontologists to go and have medication reviews when I see this sort of stuff. But if we were just doing it as having you as part of it, do you think that would make a really big difference in a lot of these chronic diseases and a lot of things that might be a bit more preventable, especially things like, I say, lithium-induced kidney disease? I've seen 5 come through in emails and things this week. Like, that's a huge amount of people with, and they're young, they've been on bipolar medication that maybe hasn't been reviewed with escalating doses for 15 years, and now they need kidney, and these people need kidney transplants. Like, we're talking EGFRs of 10. So I just wonder if we had someone like you, whether a lot of this stuff would have been preventable. What are your thoughts around that sort of stuff?
I think, in mainstream medicine, the GPs on average have 15, 20 minutes to go through the diagnosis and make a decision on how to actually manage the patients. There's no time to actually double click on the medications or even look at the lifestyle causes of a lot of the signs and symptoms. We call it a prescribing cascade. For example, with the PPIs, the proton pump inhibitors that helps treat reflux. And you need like the acid to break down and to get absorbed things like iron. So I had one client who developed restless leg syndrome, and we know it's linked to iron deficiency and dopamine dysfunction. So when we double click, she was on proton pump inhibitors for years. And she also had hemochromatosis, which means that she had to be really careful with how much iron intake she actually takes. So she actually avoided it like a plague. And so because of that, she had double whammy in terms of iron deficiency from not eating red meat and also from her proton pump inhibitor. So that really contributed to her restless leg syndrome. So you kind of need a bit of a detective to again put 2 and 2 together. So doctors and naturopaths are amazing in terms of holistic diagnosis, management, putting things together. Whilst I probably have a different pair of eyes, where with my eyes, I'd be looking at, which medications would be toxic. And we didn't talk about antibiotics. And it's about, again, about risk benefit, how it actually can actually impact kidney disease and things that cause muscle damage. So that's going to, again, bump up your creatine, unnaturally your statins, and things like paracetamol can also impact somebody with kidney problems. Even going for investigations like for radio contrast media, even the material used as well can actually cause kidney dysfunction. So it's ubiquitous, it's everywhere. The ones that very, very common in mainstream and the chronic kidney disease management guide says that, even during a sick day, when you can't actually eat or drink and you're dehydrated, they have an acronym called SADMANS. And that sort of consists of sulfonylureas, which is for diabetes. So a brand name would be dimicron, which has got glucoside. A for ACE inhibitor, so that's your blood pressure pill. It could be perindopril, enalapril, so anything with a pril at the end of it. Any diuretics, like anything that helps with the fluid, retention, metformin, your angiotensin receptor blockers, your candesartan, telmisartan, we know the NSAIDs, and your SGLT2 inhibitors that diabetes medication that makes you pee. So having a sick day means that you've got to be careful with these medications because it's going to cause dehydration. And we know that your kidney is a bit like your engine oil. And if you haven't got any engine oil, it's just going to cark it. And I've seen it in this patient of mine. He was on an SGLT2 inhibitor, empagliflozin. He had a toe amputated for his type 2 diabetes. And we had a chat about how much water he drank. Guess how much water he drank, Fiona?
Oh no, I'm scared. I'm going to go 1 cup.
Yes. So I went through the whole spiel because I thought, okay, we'll talk about how you need water to transport the medications in the right places, and for it to actually eliminate properly so you don't have accumulation of medication. So every 2 years I come back, and I came back and his wife said, Therese, he has been discharged from hospital because of acute kidney failure. So these drugs are not harmless, and even simple thing like dehydration can actually cause massive hits on the kidney, and so it's about really having awareness. We want to protect our kidneys because it cannot regenerate like our liver, and as people grow older, things you might do everything you can to improve your health, but then the one thing that could be your Achilles heel could be your declining renal function. So you want to do everything that you can to actually maximize it, whether it's to reduce the toxin load in your environment, pesticides, what you eat and what you can control, the food that you eat as well, as clean as possible, and making sure you're drinking enough water and having enough electrolytes to have that right balance, and prioritizing everything else that's going to impact good health, whether it's sleep, stress regulation.
All the stuff we talk about all the time. And I'm interested, you touched on it with the proton pump inhibitor and the iron deficiency causing restless legs. But what are the other hidden risks of common prescriptions and things like diuretics that we know a lot of people with kidney disease are taking, that medications might deplete some of the key nutrients, and then that flow-on effect that might have a greater impact on kidney health?
I love it. So we just mentioned how water is important, but it's not just the water that gets flushed out as each time you go and pee. it's the nutrients as well, isn't it? Because it doesn't really sort of like have any special filter for nutrients. So with furosemide, which is a common loop diuretic we use in our patients with heart failure, and because their heart's not working well, they actually really retain fluid, and it becomes a vicious cycle, because when you actually have something that excretes water and nutrients, one that's come out quite consistently is thiamine, or B1. And B1 is so important for carbohydrate like metabolism and for energy. And things like loss of appetite is so common as one of the indicators. And as health professionals, thiamine deficiency is one, if we can actually ring the alarm, would be the most beneficial to maintain brain health. And so again, with thiamine deficiency, they have, if it's severe enough, you get dry beriberi or wet beriberi. And interestingly, one of the hallmarks of wet beriberi is elephantitis. So you have really thick, chunky, like fluid retention. So a lot of times, if you actually give them supplementation like thiamine, to again 300 milligrams, they've shown in randomized control trials, that can actually reverse, that sort of like issue as well. So it's sort of like balancing like what we're trying to achieve with the patient, and having the awareness that each medication that we actually prescribe, there are consequences. Even supplements that we actually prescribe can have consequences. Being aware of what to watch out for, and wanting to preserve our kidney function, because it is a determinant of longevity.
Yeah, 100% it is. We know in Chinese medicine, kidneys nourish qi, but yeah, and we know again from a scientific model, when we have a decline in kidney function, we have a decline in clotho, and clotho is our major anti-aging peptide hormone, or peptide. So I think it does both. So yeah, so I find it so fascinating. I also wanted to ask, so that I find that really, really interesting, of how certain medications will cause nutrient deficiencies, and then you get this loop going on. What are, in your work, when you're working with someone, what are your go-tos when it comes to preserving kidney function? You've mentioned hydration and diet, but what are your other sort of go-tos, and walk us through some real life case studies that you've had when you've been working with people that have come in, and how maybe, obviously you're a poor guy that didn't change his water intake, but have you had people that do take things on board, and then you start to see big improvements, or at least a prevention of further decline and things like that?
So I had one client, and he drank, I think when you ask him what's your favorite beverage, and it could be tea, and tea doesn't count obviously because it's diuretic. And so when we look at a little bit further, he doesn't drink water. And then you kind of figure out, okay, why are you not drinking? Is it because of the taste of water? You want to add something that's a bit more, bubbly, or, what do you want to again drink? Or you might drink Coke all the time because you want to quench it, or you want to have that fizz in your life. So I've had clients who have beverages that might not serve them, and not aware that, even though you drink 12 cups of tea a day, it doesn't count to your overall hydration level. Because it's going to make you pee, it's got caffeine, and it's going to affect your sleep as well. And so we have a chat about, why is it that they're not drinking? And so I had one client who was drinking maybe 3 or 4 glasses, and he was about creating clearance 70 mils a minute. So I wrote in the report, because he's on these medications, he's not drinking much, there's risk of toxin accumulation. So he actually increased it, and within a couple of months, it went from 70 mils a minute to 80 mils a minute.
Wow.
It's simple. It's simple, when you actually double click on the why, why are you not drinking water? A lot of times, truck drivers, anyone in agriculture, they seem to have trained their bladder, because time is of the essence. They haven't got time to go to the outhouse. They haven't got time to stop for a pit stop, and so they train their bladder so well that they, even in retirement, they forgot to drink. So,
yeah.
And I think for me, that makes the biggest difference in terms of that. But I think electrolytes play a part as well. So I've had clients as well who might be drinking enough. It's about, when are they drinking? Are they taking their last glass, a large glass of water with their night medicines? And do you need that much water? Because timing is of the essence. You want to preserve your sleep function, because if you get 7 hours sleep, that's your detoxification, that's your rest, your restoration. Any impact or reduction in that is going to impact your heart health, your cancer risk, and that's the thing. So it's really important to prioritize sleep. So I would be talking about how, what's your routine before sleep? And a lot of times it's like watching the telly, or the computer, the blue light devices. So it's
Yes.
about so the health is really simple, drink enough water and making sure that you actually wind down and avoid blue light devices, whether it's your television, whether it's your mobile phone, etc. And then making sure that they get electrolytes, because if you've done all the right things and you still frequently going to the toilet, because there's antidiuretic hormone, and you might be activating it because it's so diluted, the body likes things in balance, like in homeostasis. So the concentration of your blood is paramount, and the body will do anything and fight for it to be at that particular concentration. So if you drink too much water and that concentration is dysregulated, so it's going to make you pee. So nighttime, they might be peeing as well. So a lot of times I find electrolytes make a big difference, and I don't use any of those over-the-counter ones. I get the ones that's free of sugar and the nasties, because the last thing you want to do is adding preservatives and sugar to make it palatable. So it's important to have electrolytes, especially when you sweat a lot. So in Queensland, everybody sweats because of the weather. So you don't necessarily have to be an athlete to require electrolytes.
Yeah.
So the success to good kidney function is drinking enough, getting your sleep right, and making sure you have enough electrolytes.
You make it sound so simple, but it's so true, right? Electrolytes are the 101 when it comes to kidney function. I totally agree with you. So, and there's been enough clinical studies now. I talk about this with Jess all the time, is that if you take out potassium, which a lot of people do with kidney disease, you actually accelerate the decline of kidney disease, unless a blood test absolutely says, yes, you're not clearing potassium properly. But we generally see that right when people are about to go on dialysis or right at the end, versus as a general rule of taking potassium out. So you're right, knocking around your electrolyte balance and playing with it by yourself is not something to do. It's definitely worth using well-balanced electrolytes, as you mentioned, free of the crap and the sugar and the artificial stuff, using good quality that way, which also will help alkalize your blood as well and take the pressure off the kidneys. Therese, so enlightening. What other things, what are some of your lasting words of wisdom that you want to pass on to anyone listening that might be on multiple medications and having kidney disease? What do you feel like as a patient is the absolute thing that they need to know to be able to maximize their kidney function and health?
I think it's important that they know why they're taking the medication, and then B, are they getting benefit from it? And 3, since starting the medication, what has happened? Has it improved your health? Have you had more side effects? And I think when you know the answers to 3 of these questions, it means that you're making an informed decision whether this medicine is going to serve you or whether it's going to be harmful to your health. And knowing that, and you are like the CEO of your body. You might see us health professionals maybe 1 hour, if you're lucky, but you have how many years of experience, and you need to tap into that and really take control in terms of knowing why you're on something, what are the pros and the cons of it, and does it serve your health?
Yeah, I think such a valuable takeaway. I think so many people, and definitely what I see in clinical practices, like we've mentioned, they've been on medication for years and they forget to ask those key questions, that they just get used to taking it. But is the medication actually still adding value? Is it at the right dosage? And is it improving your health? I'm a big believer that no medication, including natural medicines, should be forever. If we can really, and it's harder with chronic disease and chronic kidney disease, but if we really truly address the underlying causes by changing diet, lifestyle, maximizing sleep, hydration, all the things that you've spoken to, do you still need to be on a medication if you can make some of those big changes?
Yeah. I remember you telling me how, I asked you in my podcast, what is the biggest lesson you learned? And that the lesson you learned, do you remember, is about the body wants to heal, and it's in partnership, and it's about listening to the body and having awareness and giving it, the opportunity to heal by listening, and then addressing whatever it is. And we're all on a health journey, and the journey we need to learn whether it's about self care, and it's about asking what's preventing us from having good sleep, and what's stopping us from getting there, and asking the difficult questions and moving forward, and doing something about it.
I love it. I think that's such a great takeaway. Therese, it's been so wonderful to have your wisdom and knowledge. It's been so exciting to have a pharmacist who, you know, you impress me no end of just has your mindset and how you think about things. And it definitely reinvigorates my need to engage more with, you know, well-qualified pharmacists like yourself that have an interest in this. So we're looking at things, and, you know, I would say as polypharmacy and polymedications is an issue, I would say that there's also an issue with lots of people on way too many supplements as well that could be doing that. So I think it's a really important thing to know. And you're right, like if we are treating the cause and not the effect, that eventually we hopefully don't need so many interventions. So your words of wisdom have been greatly appreciated, and I'm sure our community will love to know more. If people want to know more about you, your podcast link, so I'll put those details below, but tell us more about that. What can people expect to hear when they go and listen to your amazing podcast?
So I like to interview podcast guests like yourself who have transformed either their own health or clients. And so I do it once a month, and people can actually go to the Enlightened Pharmacist to actually listen. And also I'm quite active on LinkedIn under Therese L'Seow. Yeah.
Perfect. Well, I'll put in your link. Yeah, I'll put in your LinkedIn details and the link to your podcast underneath there. If anyone has any specific questions for Therese, please put them in the comments below and I'll be sure to reach out to her. And if there are medications, I know we've done some podcasts with some of the renal dietitians and things like that, but if there are any certain medications that you would like to pick this wonderful woman's brain about, please put it in the comments below, because I would love any excuse to get it back onto the podcast and we can do a dive onto some of the medications, how it affects kidney disease, the pros and cons. Like the SGLT ones, I find that is so interesting. I knew it increased urine output of sugar, but I didn't realize it actually had a potential to decrease kidney function. So some of those things I find really interesting. So thank you so much for your time and your wisdom. I'm sure we'll get you back, because I'm sure people are going to want us to do some deep dives on some certain medications. For everyone listening, make sure you hit like and subscribe. That way you'll get notified anytime we put out new content. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on all socials under the same platform. Therese, thank you so much again. If you want to reach out to Therese, she is in Australia. I'll put all her details in below. And again, anytime you want her to come back and talk about a different medication, please add a comment and I will be sure to get her back on. And Therese, thank you so much for being part of it. I appreciate you and I look forward to seeing everybody next time. Bye.